Okay, first I want to welcome everybody that's tuning in. Thank you on behalf of First Christian Church. We are so honored to have 3 members of our congregation who are also mental health professionals to come and share their expertise and their passions with us, not only during this time with coronavirus and the isolation is mental health important, but mental health is one of the aspects of our overall health. It goes into our physical health, it adds into our spiritual health, and so at First Christian Church, we just want to open that conversation of, are you taking care of your mental health? So briefly, let me introduce our 3 experts today on our panel. First, we have Ashley Cox. She graduated from John Brown University with a master's in community counseling. She's a licensed professional counselor and a registered play therapist, and she has 9 years experience in a residential treatment setting. She now provides outpatient services at Emerge Therapy Services in Bentonville. She's EMDR and trauma-focused cognitive behavioral therapy certified. She specializes in children 2 to 12 and their families addressing trauma. So thank you, Ashley, for being with us. We also have DeAndre Jones. He is a licensed social worker with 20 years experience. He has earned his master's of social work from Arizona State University and is a doctoral student at the Chicago School of Professional Psychology. His passions and expertise include mental health, social justice, racial diversity, and political activism. He served as a guest presenter at many conferences, including the Arkansas chapter of the National Association of Social Workers Conference and the annual Clinton Global Initiative University meeting. DeAndre worked for 2 years providing support for chronic pain patients and has also worked at Ozark Guidance and the Razorback football team as a mental health professional and learning specialist. He believes that building awareness is critical to dispel the myths concerning the stigma of mental health. Thank you, DeAndre, for being here.
Thank you for having me.
And Jamie, we have Jamie Woods with us. She currently holds an EDS in clinical and mental health from Harding University. She has 23 years experience in the field of counseling and has spent 5 years working with men in a maximum security prison with diverse diagnoses. She then transitioned to working in public schools as a school counselor, and she's currently the director of counseling and mental health services in Pea Ridge. She's also in private practice at the Joshua Center, and she's certified in a therapeutic process called brain spotting. Jamie specializes in trauma and addiction in teens through adulthood. Thank you, Jamie, for being with us. Most importantly, Jamie, DeAndre, and Ashley are all children of God, and God has placed this special calling on their life. And so I'm excited to hear all that they have learned and all that they are willing to share with us. So I'm going to hand it off to Ashley.
Hi, I am going to take a few minutes just to talk about anxiety in children. Right now, I am getting lots of questions from parents about what does anxiety look like? Why is my kid acting out? They don't say they're scared or nervous, but they're having tantrums every day. And so just kind of talk a little bit about some signs that kids show when they are feeling nervous or anxious about things. As adults, we're able to say, hey, I'm feeling nervous about an uncertain future with COVID right now, or I'm feeling nervous because I have a big presentation at work. Kids don't have that verbal capacity for the most part, especially our littles. So they're more likely to express their anxiety in different ways. So I'm just going to go over a few common ways that I see kids expressing their anxiety. One of the first big ones is, I have a tummy ache. I mean, kids will talk about, I've got a tummy ache, I've got a headache, or I don't feel good, even when there's nothing going on, and I've had parents take kids to the doctor and they're like, they've got a tummy ache every day, but there's no medical reason for it. And a lot of times it's because they've got something that's stressing them out in their life, and they just feel it in their body, and they don't understand that that's because they're worried or upset about something. Another thing, kids have a lot of difficulty staying focused. This is one that I have seen a lot right now. Kids are doing school at home, or they're doing their Zoom classrooms, and they're just not able to stay focused on anything. And some of it, yes, is different environment, different routine, but some of it's also, this is a very uncertain time, and kids don't really know what's going on, and it makes them nervous. And so they're having a harder time staying focused on tasks that they normally are able to do well. Difficulty sleeping, another one. So we've got kids that are not wanting to go to bed at night. They are staying up really late, or they're not wanting to get up in the morning. They're sleeping more than usual. That can also be a sign of some anxiety. Nightmares go with that as well. Frequent mood swings. So you have a kid that's normally really happy-go-lucky, and then all of a sudden they're having periods of just crying, or they're really grouchy and angry, having those tantrums, overreacting to really small things. So they're playing a game and, you know, sibling comes over and knocks over the toy you're playing with, and all of a sudden it's an epic meltdown when normally they would just say, oh, that's okay, I'll try again. Being really scared of making mistakes. That's another one that's very common with kids when they're feeling nervous or worried about things. They're afraid that if I make a mistake, then what? Let's see. Worrying about something bad happening. I see this a lot in kids as well. Those are those big what if questions. So I'll have kids that are like, well, what if mommy doesn't come get me? Or what if something happens to dad? Or what if grandma has a car wreck? All of these are signs that they're having some other worries that are going on in their life. And they're kind of concerned that something might be happening to those people that they love. Another one is transition time. If you've got a kid that usually goes to school or goes to a babysitter, fine, and all of a sudden now they're crying. They don't want parents to drop them off, or they're saying, I don't want to go to school, or I don't want to go to daycare. Those are some other signs that they're feeling a little more nervous or anxious than usual. And then just not wanting to do the things that they usually want to do. A lot of times, you know, that's a sign with adults as well, losing interest in things that they enjoy. You know, kids are the same, you know, when they're usually wanting to go outside and play, and all of a sudden they're just, I just want to stay inside and sit on the couch. Or you might see a lot of just wanting to stay by mom and dad or by their guardians and just not wanting to have that separation. It's that they're seeking out that connection because they are feeling a little bit more worried. Another thing you might see is very tense muscles. You know, parents, you know, adults do this too. When you're feeling more nervous and worried, you kind of hold tension more. And so kids do that also. So there's a lot of other symptoms. Those are some common ones that I see frequently. So then what do we do if we see that kids are having some anxiety? The first thing I tell parents is, it's okay. Be patient, be calm. It's not a huge problem. A lot of times people are like, oh, I see my kid is acting out and they're really anxious. What's wrong with them? So starting, you know, take away that stigma of something is wrong and start saying, okay, what can we do that's going to help them feel better? So the number one thing that I tell parents is to listen to their kids. Listen to what they're saying, or, you know, things that they're expressing, because they're trying to tell you things, even if it's not saying, hey, I'm feeling really nervous about this. They're expressing themselves. And so taking the time to be patient and listen to what they're saying. And make talking about feelings an open dialogue. Make it something you guys do every day. I use a lot of feeling charts, and I have a couple examples. You can find these online anywhere. And so there's some that are as simple. We've got little I feel, and it's little kid faces that you can use. There's more advanced ones. These I would definitely say are more for older kids. They have some more advanced situations. And then something I do with my clients in session, and I encourage families to use at home, is make your own. And so these are just some really simple little feeling faces, and then I'll let the kids color them. So if for them, happy is a big orange smiley face, then that's what they color it. Or sad might be purple. You know, it doesn't have to be the typical yellow, blue, red for feelings. And then let them identify, this is what the feeling is, and this is what it looks like for me. And then having parents talk about it too. You know, sharing different times that they have different emotions. So if a kid is talking about, you know, oh, something happened and I felt really sad, the parent, give them the opportunity to say, oh, I understand that made you feel sad. This is what makes me feel sad sometimes too. And it just creates an open dialogue. And the more that you guys talk about feelings and make that a part of your daily life, the easier it will be for them to talk about feelings in the moment. Another thing that I've talked about with parents, and this is a really hard one. This is a really hard one for me when I'm talking with my clients sometimes, is resist the urge to minimize or try to dismiss their concerns. So if you've got a kid that's saying, I'm so worried you're going to get in a car wreck, don't just be like, oh, I'll be fine. Validate those feelings and be like, I understand that you're really worried about that, rather than just say, oh, no, that's not going to happen. And so that takes some practice sometimes, because, as caregivers, we want to put our kiddos at ease and not be like, oh, that could happen. You want to be like, oh, no, nothing's going to happen. And so rather than just completely minimize their concerns, validate those feelings and have a discussion about it. Trying to keep a routine. That one I know is really hard right now with COVID going on, but having a routine helps kids have some consistency and know what to expect. So if you've got a kid that's having a lot of anxiety that doesn't know what is going to happen today, not having a routine can make it a little bit more escalating for them, because they don't know, oh, what's going to happen. So having that routine can be very helpful. And then allowing extra time for transition. So if you know that you guys have to go to the babysitter today and that's been a really hard thing, rather than get there right on time and you have to get to your next appointment, maybe get there a few minutes early so that you have time to help with that transition, to give them time to express those emotions. You guys can talk about the feelings and then move on with that transition. One of the things that can also be helpful is understanding triggers for these anxiety attacks, or the things that you're noticing. And there's a few different ways to do that. A lot of times parents can start making notes and look at kind of like keeping a log. So if you notice that your child got really upset, document, okay, they got really upset. This was the time of day. This is what was going on around that time. And then as you document those as you're going on, you'll be able to go back and look for patterns. Something for my older kiddos and, talking, old enough to be able to keep some of their own records, and teenagers, have them keep an emotion log. And so maybe even, every day they write down what kind of feelings they had today. With some of my kids that are a little bit younger, I might just have them put, have like a little printout calendar and put a smiley face or a sad face or a mad face, just so they can start documenting how they're feeling. And that also lets you kind of look at, okay, what are the patterns? And they can start seeing it themselves. And then modify your expectations. So this one can be a hard one for parents too. But if you know that it's going to be a stressful day, you guys are doing something that's out of your routine, maybe not expect that their behaviors are going to be perfect. Expect that, okay, I know that this goes against what their routine is. We're going to be doing some things that are related to the triggers that I've seen. I'm going to modify what I'm expecting of them and give them some grace, and just knowing that, hey, this could be a hard day and it's okay, and not have to be striving for that perfection. So the last thing to do is making a plan of action. So this is going to be something that you can work together as a family, and you're going to do it before and you're in a situation where the anxiety is high. So talking with your kids about what can we do when we feel upset. So practice some coping skills. So a lot of my kids, we do deep breathing. It's something you can do anywhere, any place, and it can be relaxing. There's even apps on your phone you can download that kids can look at that have like a picture that tells them breathe in for this long, breathe out, and they can match their breathing to an app on the phone. You practice together, show them you can breathe together. That one, it's a really good resource. It's one I use a lot, and it's so simple. Another thing is working with your kiddo to make a calm down kit. This is something that I recommend a lot. So having just like a little bag that has 3 or 4 things or activities in it that you guys have discussed as a family that helps when someone's feeling upset. So some ideas to have in your kit might be bubbles. because you have to breathe slowly to blow a bubble. And so that's a good way to practice that breathing. And it's something fun that lots of kids enjoy. Having a little stuffed animal. So if they have like a little toy that makes them feel safe, they can be in their calm down kit. And then they know, hey, when I'm upset, I can give my stuffed animal a hug. Coloring books. Coloring can be a good way to calm down. They can have just blank paper. They can scribble. It doesn't have to be, we're going to draw a really pretty picture today. It can just be, we're going to scribble out our feelings. Some pictures. Sometimes kids like to look at things that make them feel safe. So if there's a lot of anxiety about worry for family members, you might have a family picture that they can look at that reminds them of everyone being together and safe. Or if they really like Mickey Mouse, then that makes them feel safe. You know, they might have a picture of Mickey Mouse in there. Just something that's going to help them focus on something else that makes them feel safe and brings them out of that anxiety and into that moment. Other things like Play-Doh, something they can squish, like little ball, like a squishy toy, just anything that they can do that they enjoy that's going to help them calm down. And then once you have your calm down kit, think of a calm down place. So is there somewhere they can go for a timeout where they're going to be safe? And, you know, maybe if they've got siblings, you guys discuss when someone's in their timeout place, this is a place we don't go bother them. So if, you know, brother is in the timeout little cubby, you know, sister's not going to go and be like, hey, let's go play, because brother's needing that time to play. And then practice this whole, you know, calm down plan when everyone is calm, so that it's not something that's new and in the moment. So if you guys know, like once a week, we're going to be like, okay, let's practice our calm down. We're going to do some deep breathing. We're going to practice getting our kit and going to our safe place, and just making it something that's part of their routine and not something that seems like a punishment in the moment. Because sometimes we tell kids, you need to calm down, or something, you know, go to the corner or go to your room, when we're trying to be helpful, but it really comes across to them as, I'm upset and I'm in trouble because I'm upset. So making it part of their routine and knowing that, hey, it's okay to be upset. We can talk about our feelings and we can do things to help us feel better and calm down. And then the last thing, just if you're noticing that your kiddo is having a lot of anxiety and it's starting to keep them from living their best life, you might go ahead and reach out to a professional and just talk with them. And there's a lot of people that you can just have an intake and assessment and say what is going on, and if they think it's a concern or if this is age appropriate. But don't be afraid to reach out to someone. There's a lot of people that we can talk through things and help you and have support for you as well. Thank you.
Thank you, Ashley. So one quick question. If as a parent, you feel like maybe my child's behavior or anxiety goes beyond the scope of how I can help, and it is time to involve a professional, how do you frame that with the child? How do you open that conversation and let them know what is about to happen?
Mm-hmm. So talking about going to see a friend that's going to help us. We at our clinic, we talk about kids are our friends, the adults are our friends, and we're here to help each other. And talk about, we're going to go talk with our friend and see if we can help you feel better, or we can help ways we can talk about feelings more, or even saying, mommy needs some help too. And so we're going to go talk to a friend and see how we can make everybody feel better. Awesome. Try to make it a positive experience.
Awesome. Thank you. We are going to shift gears a little bit and hear from DeAndre Jones. He's going to talk to us about chronic pain and coping tools kind of during this time.
Thank you, Michelle, and to Pastor Sean and others who've putting on this meaningful program, especially now as we are experiencing COVID-19 and many personal challenges as well. Can you guys hear me? Okay, thank you. I've had for the past, I believe 2 years, I worked at a pain management clinic. And I'm going to share my thoughts and strategies and tools, and also research as it relates to defining chronic pain and how depression and anxiety, how they can, when individuals who are struggling with chronic pain, how many times anxiety and depression can manifest. Chronic pain is a term used to describe pain that lasts beyond the typical time it takes for an illness or injury to heal. Sometimes chronic pain is also described as pain that lasts longer than 3 months. Research suggests that anywhere from 30 to 50% of people with chronic pain also struggle with depression or anxiety. Now, chronic pain isn't just a physical condition, it's an emotional one as well that has tremendous influence over a person's thoughts and moods. People with chronic pain may isolate from others or be unable to achieve mobility they once had. Some of the most common types of chronic pain include headache, post-surgical pain, post-trauma pain, lower back pain, cancer pain, arthritis pain, neurogenic pain, pain caused by nerve damage, psychogenic pain, pain that isn't necessarily caused by disease, injury, or nerve damage. Sometimes it can be difficult to assess whether chronic pain has led to depression and anxiety or vice versa. People with chronic pain are 3 times more likely to develop symptoms of depression or anxiety, and people with depression are 3 times as likely to develop chronic pain. We know that everyone experiences pain at some point, right? But for those with depression or anxiety, pain can become particularly intense and hard to treat. People suffering from depression, for example, tend to experience more severe and long-lasting pain than other people. Depression frequently can cause unexplained pain, such as headaches or back pain, and people who are depressed might struggle to improve or maintain their physical health. In turn, chronic pain can lead to trouble sleeping, increased stress, or feelings of guilt or worthlessness associated with depression. These influences can create a cycle that is unfortunately hard to break. Although depression can further cause chronic pain to worsen, these people may be less likely to recognize and talk about symptoms of depression with their doctor. In fact, half of all depressed persons who visit the doctor only complain about physical symptoms. Because both pain and depression make each other difficult to treat, it's very important to address both when evaluating treatment options. You might be suffering from depression in addition to chronic pain if you have experienced some of the following symptoms: lack of interest in activities, depressed mood or irritability, changes in sleep patterns, changes in appetite, feelings of guilt or despair, lack of energy, trouble concentrating, and suicidal thoughts. It's very important to assemble a treatment team. Patients benefit the most when chronic pain and depression and anxiety are treated together and utilize a team of people. This team of experts may include a physician. A physician can provide a thorough examination and evaluation, give a diagnosis, and if necessary, prescribe both pain and psychiatric medications. Pain specialist. A pain specialist can educate the patient about the relationship between chronic pain, depression, and anxiety, and can help design a treatment plan. A therapist, of course. Regular sessions with a therapist trained in cognitive behavioral therapy or other forms of psychotherapy can help address anxious or negative thinking patterns and teach coping skills that reduce symptoms of both pain and depression. They can also work with patients' families to help them better understand chronic pain and depression. A physical therapist is also an important part of the treatment team. A physical therapist who can help improve mobility, reduce pain, and increase low mood by introducing helpful exercises and muscle relaxation techniques. Other professionals such as nutritionists, acupuncturists, and occupational therapists can also provide special and very meaningful knowledge to help curb chronic pain and depression. Treatment options. There are many treatment options available which can provide relief and healing to chronic pain, anxiety, and depression. And some of these treatment options include, of course, cognitive behavioral therapy, talk therapy, also known as psychotherapy. Talk therapy can, of course, help an individual change patterns in thinking, learn coping skills for symptoms, and help prevent future depressive symptoms. Stress reduction skills. These skills can include exercise, muscle relaxation, meditation, positive thinking, etc. Therapists, pain specialists, physical therapists, and others can provide recommendations to fit the needs and interests of the individual patient. Medications. For extreme pain, opiates may be prescribed, but we encourage patients, talk to your doctor about the risk and history of any substance use first. Antidepressants can also be used. A variety of antidepressants are prescribed for both anxiety and depression. Some of these also help alleviate nerve pain. The research most strongly supports the use of serotonin and SNRIs, or tricyclic antidepressants, which are referred to as TCAs, as double-duty drugs. They can treat both psychiatric disorders and pain. The findings are more mixed about the ability of SSRIs to alleviate pain. Mood stabilizers. Anticonvulsants are sometimes used to stabilize mood. These medications exert their effects by constraining aberrant electrical activity and hyperresponsiveness in the brain, which contributes to seizures. Because chronic pain in particular involves nerve hypersensitivity, some of these medications may provide relief. Peer support is also crucial. Many people find that support groups for chronic pain, mental illness, or both can provide emotional support and psychoeducation. If there isn't an in-person group in your area, consider looking for online support. Inpatient or outpatient pain programs. More intensive programs can provide immediate and long-term support when depression and/or chronic pain is severe. These programs typically provide on-site medical support, individual and group therapy, and psychoeducation for reducing both stress and pain. Relaxation training. Various techniques can help people to relax and reduce the stress response. Stress tends to make pain worse, as well as symptoms of anxiety and depression. Techniques include progressive muscle relaxation, yoga, and mindfulness training. And exercise. There's an abundance of research that regular physical body boosts the mood and alleviates anxiety. Unfortunately, there's less evidence about its impact on pain. So I just wanted to provide a real quick overview, kind of describing chronic pain, depression, and anxiety, and how they can impact chronic pain, but also to, I think, more importantly, provide coping strategies and resources, which have proven to be ways to be more effective.
Thank you, DeAndre. If I know that sometimes people with chronic pain don't look sick, how do they convey that that to loved ones that might seem to feel like you're always hurting? What advice would you give to people that are suffering with chronic pain, and how they talk about that, and how they invite others to support them?
Jamie, I'm sorry, Michelle, that's a very good question. And what I found to be, one of the things that I found to be very useful, getting education about the pain from the doctor, making sure that the doctor provides the necessary education so the patient can share that information with the family members. And I look at treatment sometimes as a family situation. When individuals in families understand the pain, then they are, I think, less likely to experience what you just described. And so I do believe that it's very important for the patient to include the family in the journey, and making sure that the doctor is also providing the necessary education concerning the illness or the chronic pain.
Wonderful. Thank you, DeAndre. All right, next, Miss Jamie Woods.
Thank you. Thank you, Michelle and Pastor Sean, for allowing me to be a part of this. And Ashley and DeAndre, awesome information. Thank you so much for sharing. I'm going to come at it and kind of wrap it up, I think, a little bit, because what Ashley and DeAndre touched in all kind of flows into what I'm going to talk about. And I'm going to come at this being very authentic and I think vulnerable. That's a hard place for anybody to be. So I'm going to try to be there because I think we ask our clients to be there with us. So I'm going to share a little bit. And I don't know if you would say I have a passion for, but I feel like because I have addiction in my family, and I feel pretty safe in saying a lot of families have been touched by addiction in some way. So I journey, pray, walk with quite a few people, clients and families through this, the recovery and the tough road towards working through addiction. I think there's a cliche that says insanity is doing the same things over and over and expecting different results. I think that's addiction. Families and loved ones, when dealing with an addict, try to bring about some sort of positive change and try to do the same things over and over, only to be devastated. I think that's a good word, devastated with each relapse, if there is a relapse. And then there's total isolation on the part of the addict. It's a tough place to be. We often question if the behavior or mental illness is causing the addiction, if that makes sense. Are they depressed? Are they anxious, and are they self-medicating, or does the addiction bring about some depression or some anxiety? So, there's a question there regarding addiction that I think we all question that have walked with an addict through their recovery or through their addiction. Is there some trauma or life experience that's causing the addiction? There are no clear answers to me, and I don't know if anybody has clear answers. I often think addiction is due to a number of reasons, and it can and should be treated in a number of ways. I don't think that there's one way to work with addiction, and I don't think there is one, what you want to say, cure for addiction. Addiction is such a hard diagnosis and disease to work with because there's little to match the power of this addiction. Very little allows us, the family, community, or therapist, to get inside somebody else's brain and engineer the change in feelings, attitudes, perceptions that form the foundation of a recovery. It takes a lot of work for all involved and a lot of love for those close to the journey with this addict. Not one addict that I have ever worked with or lived with wake up in the morning and say, today I'm going to be the best addict I can be. All of us wake up and want to be the best person we can be, but often some of us deal and fight demons and battles that they're unable to overcome. Addiction is truly one of the great, I believe right now, social and medical dilemmas that we are working with and trying to overcome. And my love and my heart is I hope to help walk with and love individuals and their families in their journey to seek answers and healing. Right now, and we're talking about in this, I think in this forum and in this series, we're talking about a little bit also tying it in with COVID and what we're going through in life right now. And think about a journey, if we can, that an addict is walking and that they need so much support and avenues available for them. And right now, those are gone. We don't have Celebrate Recovery. We don't have AA. We don't have NA. And the families that are walking with the addicts are lacking. They can't go to Al-Anon. So right now, we have a lot of mental health facilities that deal with addictions that are shutting their doors due to the quarantine and isolation. And that's, a lot of people that are out battling this on their own. There are a lot of people they can reach out to, but it's, again, a place of being very vulnerable. It's a hard place to be. And so there's a lot of us out there. I think, there's Ashley that was just speaking to that, DeAndre. There's a lot of people that are willing and want to help individuals that need this help. But it is very tough right now to find somebody to journey with, like I said, in this quarantine and time of aloneness. And I think a lot of us are feeling that right now. So I hope that people understand and know there's a lot of people that love them and are here for them.
Thank you, Jamie. Thank
You're
you. If someone is living and kind of quarantined and isolated right now with someone either who is in recovery from addiction or in a current state of addiction, what advice or what support would you give to them?
That's a tough one right now. Like I said, there's a lot of people out there that can work with them. There are a lot of services available. It's just a lot of it is on Zoom. Right now, we are transitioning back to being able to work with clients, individuals, one-on-one. I just think there's a lot of connection that is needed on the part of an addict. I think they need a lot of validation, connection, and support when walking through this. And I think families need to educate. It's a family disease. And I can't stress enough that when an addict suffers, the family suffers. So I think we all need to reach out and find somebody that understands and can walk with them through this journey. And you all need support. It's just a lot of support, a lot of connection, a lot of love, and understanding that it's a disease that we're all fighting together. So reaching out and just finding somebody that can walk with you.
Awesome. Thank you. Thank you to Ashley and DeAndre and Jamie. That was a lot of great information in a short amount of time. And that was one of the reasons why we're recording this, so people can go back and use it as a resource and watch it several times and let that kind of sink in and bring up questions and bring up feelings. Our goal is to host a Zoom with DeAndre and Jamie and Ashley and invite anyone that would like to be a part of that. And so if you're interested in the possibility of interacting with them in real time and asking questions as you feel comfortable, please contact the church office. We will kind of create a group of people that are interested and then send out those Zoom information links confidentially. And so we welcome the opportunity for our community to start talking about mental health. I'm grateful to our church, First Christian Church, that is leading this conversation and that is saying that mental health matters, not only now, but every day. And that as we start to turn and return to a new normal that looks maybe a little different, that mental health is one of those things that we should think about, that we should take care of for ourselves and encourage our family members to take care of as well. Ashley, DeAndre, Jamie, I appreciate your time. I appreciate your expertise. You were all so willing to jump in and share your knowledge. And so I thank you for that.
Thank you for asking.
Thank you, Michelle.
All right. Y'all have a wonderful day.
Blessings.
Thanks.